Hey, folks, welcome back to another episode of the Change Physician Podcast. This is your host, Dr. Kevin Kukar, with my fabulous co-host, Dr. Melissa Cady, and today's amazing guest, Giavonne Rondo. And Dr. Rondo has an incredible story. We're going to start back at the beginning, obviously, and then progress into what she's doing now, which is some interesting stuff, but we'll hold off till the end here. And so, Giavonne, thank you so much for joining us today on the Change Physician.
Thank you all so much for just having this and for having me. It's just such a delight to do this. This is actually I've never done a podcast.
Oh,
so this is just amazing to be able to do this. Yeah.
Well, let me just warn you.
Yeah.
Melissa is very hardcore, and she makes our guests cry. I'm the nice, the good cop, bad cop routine. I'm the nice one.
Okay.
Okay.
I'm with it. Okay.
But I think you'll do fine with this. So, but we're joking around, but I want to start back at why you decided to go into medicine. Why did you make that initial decision? There's a lot of commitment to it. I don't think many of us know what we're getting into, but why did you make that choice?
I wanted a challenge.
Okay.
I liked the challenge. I liked a good challenge. And I had never really thought about being a physician young in life. I know a lot of people talk about, oh yeah, I knew when I was a kid, and I knew when I was, really young that I wanted to be a doctor. Me, nope. I had trouble with the sciences, with math. And I literally thought of it as a great challenge that let me just kind of see if I can do this. I actually had, a lot of experience in hospitals, and both my parents were really sick. I'm the youngest of 8 children. And so being the baby, my parents were older. And so I was always in and out of hospitals and stuff. And I loved our family doctor. And I thought about, maybe I can do nursing, but I never saw any other African-American, physicians or anything like that. I saw a few nurses and I thought, okay, let's maybe do nursing. And then someone put a little bug in my ear and said, maybe consider being a doctor. And I was like, maybe not. And then they were like, challenge yourself and see. And I thought, okay, let me, that is a lot of science. It's a lot of math, and it's but let me see, because one of the things that I didn't want to do is be much older and then regret that I didn't try. Maybe if I tried and I fell on my face, yeah, but I didn't want to be 90 and then be like, well, what would have happened if I'd at least tried? So really, medicine was just in a way kind of like a challenge. Let's see if I can actually do it. And so I ended up going off to college and kind of, looking into different fields and kind of, still interested in maybe some other things, but I just kept going back to the sciences, kept going back to medicine and being a physician. There was just something that just kept drawing me to it. I really loved helping people. And one of the things that I found, both my parents, like I said, were sick when I was in middle school and also high school. And I always wanted to help them, but I couldn't. So this was kind of a way that I could do just that to help. And I, still do that to this day. So awesome. I made the right decision.
So you do this challenge and you start this challenge, and then the day comes you get accepted to medical school. So what was your medical school experiences, and did they sort of line up with that same challenging viewpoint?
When I asked for a challenge, I got it in medical school. Medical school was tough. Yeah. It was, I definitely have to say that was the hardest several years of my life, for real. So let me just kind of back up a little bit. So when I went off to college, my mother died. And so that was tough. But it made me that much more, okay, this is, something that I really want to do to help others. So when I got into medical school, my father had a massive stroke. Wow. 6 months later, he had another massive stroke. And so he was completely bedridden. So my first year of medical school, I was taking, anatomy, physiology, and coming home and taking care of him. Wow. And that was really difficult, really difficult. So I kind of felt I had a personal, relationship. And then of course I was doing what I was doing in the classroom. So it was hard. And so throughout medical school, I always say that my dad was actually my very first patient, and he was. So when I got through the first 2 years and then started doing the actual physical exams and all of that, because it's so exciting, I would practice on my father. So I would listen to his heart and lungs, and he was just so patient and loving. And I would do a neural exam. He had several strokes, so his neural exam was pretty significant. So I just had, all this, real world experience, when I first started medical school. So, and that was tough. But I have a really large family and very supportive and all that. But fortunately, it still was kind of like me that kind of did everything. I was kind of like the central person who organized all my father's doctor visits. And thank goodness my dad was a veteran, so he was able to get into the VA system and get a lot of care that way. But it was tough. Medical school is probably like I said, the toughest 4 years of my life. And and so when people talk about like being in a war, I think of being in medical school. Wow. I think of I have different experiences that were very traumatic for me, and that it was rough. Yeah, it was rough. So yeah,
I just can't even imagine actually that, because you hear about challenges, and I remember looking at some of the people in our medical school class that had families and like young families.
Mm-hmm.
And I thought that was difficult, but I can't even imagine going home to a sick parent. And then, because those first 2 years of medical school are brutal. Like, I don't think anybody, you can shadow until the days come home, and you can have parents that were physicians or whatever, but until you're in the trenches, you just simply don't know the volume of material that you're being fire hosed with.
Exactly. And that's exactly why I call it a war, because you're in the trenches. You're in the trenches and fortunately you're with other people. And that's, really the beauty of medicine, is that you're with others and you're going through some of the same things. And that's really what helped me through medical school. Some of my best friends came from medical school, and so it really does help to have your comrades who you go through things with, and who can understand what it's all about and what it's like. So yeah, it's tough. The studying part is tough. Getting all that material in was, very, very difficult. But one of the things that I did have when I was in college is they had different programs that were really geared towards helping. When you decided you wanted to become a physician or a doctor, they had programs to help you. So one of the great things that we had was a summer program that taught us how to literally speed read. And not just speed read, but speed read to the point where you understand and you are able to, keep the knowledge in, really retain that information, because that's really what medical school kind of does. Is within, the first couple of years, you're taking really what is the equivalent of really 10 years of information and condensing it down to 24 months. And it's just a lot of information. Maybe I'm exaggerating that 10 years, but
not by a whole lot. I mean, it is. I like to, the actual material itself is not necessarily difficult. The problem is the volume of that material.
Yes.
And that was the thing that was just astounding to me. Like there's just a lot of material. And then in our particular program, I'll never forget, because you get to the point where you're just doing tests. It's like every Monday, Thursday we're tests. And so it's like study for one, and then the next one comes, and they study for the one, and the next one comes. But you're bringing back the memories here.
It's tough. Yes, it is tough. So,
go ahead.
No, so I said, just on top of that, just having the things that I dealt with my dad. But there was a time when I thought, is this really what I want to do? And actually, there was a time when I wasn't doing very well on one of my tests, and so unfortunately I had to repeat it. And that it was like a moment that just clarified everything for me, because I was like, do I really want to be a doctor? And if not, what else am I going to do? And I answered that just flat out. I was like, this is the only thing I can imagine doing. I don't want to do anything else. This is it. So I just kind of buckled down that much more. I'm a woman of faith, so I prayed about it, buckled down, and I was just adamant about, this is what I am going to do. I'm not going to quit. I'm not going to do something different. this is, this opportunity that I have, and I'm going to just put my full effort into it as much as I'm just going to throw it all and just do it. So, and I did. And so, but I can still remember that. It kind of gives me, I remember where I was and, everything, just because I was really torn because I didn't do it. And, we're used to being at the top, being valedictorian, being the number one in our class, or at least up there. And then when you get to a point where you're failing, whoa, that's not right. That's not where we're supposed to be. And so, so I had a lot of just, soul searching and just, and I remember that. And I knew there's nothing else I want to do at this point, nothing else. So I have to do it. So, and luckily it did, or prayerfully, it did work out. So, yeah.
So with that conviction that you were going to keep pursuing this dream of being a physician, at what point did you decide what field you wanted to be in within, or what specialty?
Well, I really enjoyed everything. And I could never really pick. So when I first went into medical school, I thought, okay, I'm going to do psych. And when I got into psych, I liked it, but then I got into OB and I liked that. And then I got into ophthalmology and I liked that. And I liked everything. And actually, I was a little bit more focused, maybe more so on, into the OBGYN sector. But then I did some work at the VA. I did some of my rotations at the VA, and my dad was a veteran. And so I saw both sides of it. And I was like, I'd miss the guys if I only saw women, So I could never, but the one field that I knew I wasn't going to do was pediatrics. No, sick kids, nope. I love kids, I love children, but sick ones, nope.
Yeah.
So I knew. So when I did my pediatrics, I said, I'm going to really enjoy this because this is the last time I want to really deal with kids. But I think that's so valuable. It's so valuable to have those. I love how we did, different rotations and had those real world, just had real experiences, hands-on, just right there with our resident or our intern. And I'm talking about from medical school, just being able to rotate and do different things. I loved it. But so the only thing that I could really say that I didn't want to do was pediatrics. So that's how I came up with internal medicine, because I could still do the range of different things. And I really enjoyed the hospital setting too. So I like the outpatient and hospital setting. I like both sexes. I like to, all the different disease states. And one of the things that I really enjoyed was how you can kind of be an advocate for your patient, and you can also teach them. I don't know. It just had everything that I wanted. You could do some psych. Actually, in practice now, it's like, gosh, I feel like maybe 70% of what I do is psych. Just sitting down, listening, talking, maybe prescribing, certain medications. But the other 30% comes, from other things. But it's like the basics for a lot of, chronic medical conditions, to me, has a mental, component. Why are you eating so much that causes your obesity, that then causes your high blood pressure, your diabetes? Why do you smoke so much? So anyway, so it all worked out anyway. So yeah.
So you took this internal medicine. Did you go into traditional type practice initially? How did that all pan out? So
when I finished my residency, I was just doing exactly what, I had been taught to do, work as an outpatient, also inpatient. And a lot of my colleagues, when I finished my residency, they were doing either going into being a hospitalist, or, just dealing with the hospital setting, or just doing outpatient, but I wanted both. And so that was very important for me, because I loved the comprehensiveness and the continuity of care that you provide when you can do both. There's just something about when you see someone in a hospital and then see them as an outpatient, how fulfilling that is, and vice versa. Knowing someone, from, the outpatient setting while they're in the hospital, and being able to have that just complete connection with them was just so wonderful. And I think also with my family history of seeing both my parents in the hospital and dealing with that, I just really loved how our family doctor, was able to take care of us in the hospital, take care of my parents in the hospital, and then also as an outpatient. He was just such a complete physician. So he's really my role model that I, kind of look to. So I continue that, into the first portion of my practice and loved it. I love it. Absolutely.
I got to ask then what happened, because you sort of touched on a nerve for me that I hadn't really thought about in a long time. And that was the guy I had shadowed for like a year or two before I went to medical school. He was an internist, and he rounded on his patients in the hospital. I don't know if anybody does that anymore, really, because he eventually had to stop, and it was because of the financial part. It is
dinosaur. Yep.
Yeah, but you kind of think about it. You are at your most vulnerable in this traumatic situation of being in a hospital, and who are you going to want to see? Everybody new, or maybe that your physician that knows you, that can carry that through. So, wow. So I what happened? Like what happened there?
Well, several things actually happened, and it was just kind of like a perfect storm. One thing I have to say is that I love taking care of people. I love the interaction that I have with just being with a patient. That is like when I'm in the room, literally, I don't know if y'all have seen Hamilton or heard it. And being in the room, that's where that's
the room where it
happened.
My
goodness, that is just the best place to be, is in that room.
Right.
Not out doing all that paperwork on the computer, out there dealing with administration, dealing with, all kind of other things, but being in the room and connecting with someone. So I got married, and I had a daughter, or I have a daughter. And so my life changed tremendously, because before I got married and before I had my daughter, I spent a lot of time in the office and, in the hospital setting. Because in my opinion, to do a good job, to do a great job like what I wanted to do, and to be about excellence, doing my best, you had to spend time. You had to spend time going to the hospital first thing in the morning. You go to your office. Then during lunch, you go back to the hospital, and then you go back to your office. And then if you got an admission, then you go back to the hospital. And so that is just not a great combination when it comes to, being a wife and being a mom, just overall. So I had to spend less time. So something really traumatic happened during my when my daughter was almost 2. And so I said, that's it. First of all, I want her to know me, because me leaving out at 6 o'clock in the morning and not coming back until 7 o'clock at night or sometimes later, doesn't lend to an optimal, parenting for me in terms of what I looked at, being a mom. And so unfortunately, both my parents had passed. So my mother, like I said, she passed when I was in college. My father died a week before I graduated from medical school. So I'm sorry, I don't mean to get. So just thinking about it, but anyway, so my support system wasn't as robust as maybe others. But regardless, I wanted to be a present mom. I wanted my daughter to know me, I remember telling a couple of my girlfriends that, honey, all she's going to say is some lady walks in, 8 o'clock at night, kisses me, and that's it, So I really want my daughter to know me, and I want to know her, and I want to be a full active participant in her care. So I had to cut back. So during that same time, there was more of a push on electronic medical records. So the combination of that, more of the electronic medical records, I found myself, okay, I'm not going to the hospital. So I stopped going to the hospital. And that was okay, but some of my patients did have a problem with that. And then I started cutting back on my hours in the office, but I still wanted to make the same amount of money. So I had to kind of squeeze more patients in. So I had to see patients quicker, in a more condensed time frame. Whew, and it was just rough. And it doesn't allow you to spend the quality time that you really need. So electronic medical records, my daughter, and then I just felt like I wasn't really for connecting as much. I wasn't, I was being more of a commodity, more of a, cog in a wheel kind of thing. When it came to the administration, I was working for a really large organization, which I had worked for when I finished my residency. So I stayed with the same practice, but the practice grew and which is great. That's great for growth. That's great just for the overall huge conglomerate that I was a part of. But I just kind of started feeling a little bit more lost. Like I'm losing what I even went into medicine for, which is to really take care of people, really love on people, and really truly take care of them, and not just, okay, spend 5 minutes with them, but really most of my attention is on the electronic medical records, trying to type in everything. I felt like Liberace, talking to them, but singing at the same time and typing and all that. And I was like, that's just not what I want to do. So with all that, I really cut back my hours, and I started thinking more and more about what my ideal kind of practice looked like, what I really wanted to do. And that's really to spend more time with my patients and be compensated accordingly, and get back to the true practice of medicine and the true love that I have, which is really, getting to know people, taking care of them, and doing just that. But there was a caveat too. And not really a caveat, but there was a time when I was doing all those things, but I wasn't really taking care of myself. So I'd go into rooms and I tell people all this stuff, and I come out of the room and I wasn't even doing it myself. I would tell them to eat well. I would tell them to exercise. I would tell them to get all this sleep. I would tell them, stop allowing such and such to treat you this way. Start, really standing up for yourself, all these things. But I'd come out of the room and I was living a different life. I was really being hypocritical. So not only did all these changes come, but I had to really be honest with myself and say, am I living that kind of life that I tell people to live? I'm not being authentic. I'm not, I'm just not. So some different things happened. Also, my daughter's father ended up being diagnosed with colon cancer. And I had to take a step back. And in a way, I had to take a step forward and back. I had to, just did a lot of soul searching, just a lot of different things. And I just decided that I really need to make some really major changes throughout the year. So like I said, I cut back my hours, really started looking into entrepreneurship, looked into, just having my own thing and being able to, and it's not just, about, money per se or business, but it's about really having everything that I want, like, having a practice and seeing people, but also having enough time to take care of myself and also my daughter, and spending time with my family, having hobbies, having other things that I do outside of the field. So even though, I'm this physician and I do all these things, but I'm mom. I'm no longer a wife anymore, but I'm mom, and I'm a granddaughter, even though both my parents are deceased. My grandmother is 103. I'm an aunt. I'm a niece. I'm a cousin. I'm a good girlfriend. I'm a part of all these community organizations. My faith is in Christ. There's just so many different things. There's so many different hats that I wear. And so I need to also have that as a part of my identity, not just I'm just the big MD or I'm just the big doctor, but I'm other things too. And I need to fulfill those roles as well without it being so much one-sided or even if it's not one-sided, just being so overwhelmed with all the different hats that I wear. So I decided that I really wanted to kind of, really have a life that is very holistic, for me, where I have time to spend with my daughter. I have time for my hobbies, just all those different things. And so being an entrepreneur and doing my own thing and really, in a way, developing my own practice, like literally what I have and who I am, no one else is really doing that in this area where I am. And so it's different when you do something when you're a pioneer. It's really, it's different and it's scary, but just like the whole challenge of getting into the field of medicine, this is another challenge. And it's like, I wouldn't do it any other way, because when I'm 103, like my grandmother, I don't want to look back and say, I wish I'd have, done this. I wish I'd have, lived a life like this. Like my grandmother now, I'm going to be going in with her in just a couple minutes, but she'll tell me just different things that she wished she had done, but she didn't have the opportunity. She was born in 1917, and as an African-American female, you can imagine the opportunities just were not there at all. So she could be a domestic, and that's what she did. But her dream had been to become a teacher, but she did not have the opportunity to actually do that. She was one of the older children in the family, and so she had to actually stop school, I believe, in the 4th grade. Wow. And start actually working. She had to actually start working at a really young age. Like my daughter is now, she'll be 11 tomorrow. And I can't even imagine her going out and working, but that's what my grandmother had to do back in her day. She had to actually start working to make money for the family. And so those opportunities just were not there. So I don't want to regret not doing something. So I could fall flat on my face tomorrow, but at least I tried and put forth that effort. So
yeah, I have 2 things. First of all, my motto for being the challenge doctor, I'm so glad you brought up challenge, because it's I always say, see change within challenge. You don't have that opportunity for growth or change without challenging yourself. So kudos to you for pushing yourself in that direction. But it's interesting. You talked about how, medical school is like a war, like kind of like you feel like you're in a war zone, but yet you're together and you're in it together, and you can get through it together, and you can lean on each other. And it's interesting when you become kind of an entrepreneur that's trying to come out of this world of everyone is, I can't think of the word right now, but everyone is conforming to the ways in which we are trained. It's to kind of evolve or challenge yourself to pull out of that conforming environment. It sometimes can feel isolating, can feel like you're alone sometimes. You kind of have to seek out those entrepreneurial mindsets, whether they're medical or not. And it does feel like sometimes you're emerging on your own amidst
Lone Ranger. Yeah,
that's right. You feel like that. And you feel like you have to wear multiple hats, using your words. And so I'm curious, with all the multiple hats, one of the other hats you had is helping and volunteering with the church's emergency medical response. Yes. And I'm not sure what the food not bombs. Can you explain that whole thing that you're involved in?
Yeah. So one of the things that I love and I'm passionate about is, in the medical field, we talk so much about, healthy lifestyles. So how do we get those healthy lifestyles to communities who are not optimally serviced, basically? So poor communities, like where I come from, West Louisville, which is a poor community, marginalized, mostly African-American population. And so a couple of years ago, a medical student, I was just, doing my thing, and a medical student that I met at my church brought a big thing of food to me and said, do you know of anyone who could use food? And I was like, oh yeah. So I found different people who could utilize the food. And so because she knew that I was really big about, I like for people to get healthy food, accessible, and I don't like waste. And so this organization called Food Not Bombs actually started way back during the Vietnam War. And it literally, they started this back then with the thought that let's give food and share food and not bombs and bombing people. So, and I live in Louisville, Kentucky, or work in Louisville, Kentucky. And so this organization actually has, different places all over the world, has different links all over the world, but it did not have one in Louisville, Kentucky. So they started it up several years ago, and I became involved in this organization. And now I'm kind of like the volunteer coordinator for it. So I get all the coordinators to go out to local stores, grocery stores, where they're going to throw away good food. And we take that good food and we bring it to communities that need that good food. And so we are supplying a need, and then we're avoiding waste, because that food is just going to go, good food is going to go to a landfill, or, so that's what Food Not Bombs is. And it's a volunteer organization. We're all volunteers. And I don't really think of it as charity. I think of it as just redistributing our resources, basically, because some of us as volunteers, sometimes we'll take some of the food. If it all doesn't go to, other people, we'll like say, hey, I'll take some of these potatoes. I'll take some of, these greens, or, milk or whatnot, because it's all going to go to waste if we don't. And I end up, taking it maybe to some of the other charity places after we've taken it to some of the locations that, we normally take it to. And so it's just basically an organization that is dedicated to redistributing good food for our community that's going to, come from grocery stores, basically. So, and I love it. I love that. I love the concept. And I just, want to see it, spread around, and I want to see more of it. How do we, stop all this waste and feed our families, feed people who need it.
Sure. That's wonderful.
All right. Well, I got to ask you, Giavonne, because we've covered, your history of practice. We've covered all these other hats that you wear, where you're a volunteer coordinator for this organization, doing fantastic stuff. You're a mother. But what are you doing now? So what made, you stepped down this entrepreneurial role. So what is your current practice?
So my current practice is actually a mobile internal medicine direct primary care practice. And it's just a fancy term for, I see patients directly, and I'm really focused on wellness and prevention for my patients. Instead of working for a big organization where you may see, an assistant or a nurse, have to deal with a lot of administrators or whatnot. Nope. My patients see me, and I can actually go to their homes or their places of business, if that's allowed, and I administer as excellent of care as I possibly can, or administer great care to them directly. And so that's what I'm doing. And I'm back to doing exactly what I love, which is taking care of people. Instead of checking boxes, dealing with prior authorizations, lots of paperwork, lots of politics, lots of other things, I'm getting back to, doing exactly what I went into medicine for, which is to truly take care of people. And that's in their homes. And it's kind of going back to the way medicine used to have been practiced, actually, when my grandmother was coming up and was around, where doctors actually came to the home. And you had a long-term relationship with the doctor, and they knew you, they took care of you in and out of the hospital. Now, that's one thing I don't do. I don't go back into the hospitals. I'm just outpatient. But what I really try to focus on is wellness, prevention, and trying to do the things upstream that avoid the problems that you'll have downstream. So that's basically what I'm doing. And my practice is called Global MD, like mobile, but with a G, because I go to the different locations. So yeah, so I like to go to where the healthcare needs are. And the way that I kind of received that was, in a way, kind of different things, but especially in the African-American community, a lot of times people don't like to come to the doctor. And I found that especially African-American males don't like to come to the doctor. And I remember when I saw my first one, it was like, oh yeah, in my old practice, I was like, oh yay. But they don't come out. And so I had different things where I would actually go to them. I would have health fairs. I would go to barbershops or whatnot. And this was early in my practice. And I loved that aspect. So I wanted to continue that by going to the locations that need healthcare. And so that's a part of some of the things that I've done. I've gone to, with the Global MD, I've gone to a couple of barbershops. Like I said, I go to patients' homes, and I provide healthcare. And what we really like to do, or what I really like to do, is take the middleman, which is insurance and administrators, out of the equation. So I don't deal with insurance. It's all just between me and the patient.
So are you set up then like your typical direct primary care where it's
Yes.
a membership model? I'm assuming.
Well, people can join in the membership model. So I allow them to do that, or they'll just do it on a visit by visit basis.
Mm-hmm.
And I have visits where I can actually see them in my office, go to their home or their place of business, and do virtual visits. So they have several different ways to choose to actually see me, literally see me. So yeah, or I see them, overall. So yeah, but it's direct primary care, and it does have a membership model. And what I love about the membership model that I developed is that it's not just me. I can take care of them, and we can, deal with that membership model, but there's an upgrade, because a lot of times it's not just what I do in the office. Most of it, and healthcare is really most of what we do at home, what we eat, how we exercise, how much sleep we get, all of those things. So what I've done is I've kind of prepared a package where people can see me as their primary care doctor, but they can also see a nutritionist or registered dietitian, and also a personal trainer, to just allow for that better accountability and that real holistic kind of model that's so very important for optimal healthcare. So it lends to, some people kind of focus on that when it comes to weight loss per se. And that's something that, some of my patients have been able to achieve is great weight loss. But it really lends to just an overall more optimal well-being. Because I know for myself personally, it's really been great because I work with the personal trainer myself, and then I don't necessarily always use a dietitian, but I do get tips that help me to make better decisions. I eat all kinds of, or I have in the past, but I'm, like I said before, I'm trying to live a better lifestyle, so that more of a model for my patients, and being much more consistent with the values that I espouse to actually, possess them myself. So kind of, the whole thing, practicing what you preach, just overall has really been something that I really like to do with this whole, Global MD just brand. And so I'm, just starting out. It's just within the last 6 months, and it's really been incredible to start a business in a pandemic. Woo! It's really been something. But I tell you, when I look at it, I'm still, this is where I need to be. This is exactly where I need to be. It's scary. I've never had a business. I've been a doctor for decades now. And so, and I love what I love what I do and everything, but this business thing, it's a huge learning curve. But I have a village that I've kind of developed of other entrepreneurs, other physician leaders who are, willing to kind of step outside of the box and do something different. So it's really been wonderful.
There's so much I would love to explore here, but I know we are approaching end of time. But we'll have to save that for another episode because, but I'll just kind of foreshadow here what I'd love to talk to you more about, which I know we're running out of time, is this idea of doing these home visits, because just like you said, that's where health is in the home.
Yes.
And I'm sure those perspectives as a physician, when you're walking in the door and then seeing that environment that people are living in and the foods that they're eating and how is it safe to even walk, and all these things come together. Yes. It really is. Anyway, we have to save that for another conversation.
Yeah. We'll have to reach out to you again. I assume globalmd.com is where everyone can find everything about you, or is there some other place too you'd like for people to find you?
Sure. It is. It's globalmd. That's GOBILEMD.com. Or they can also put in my name, Dr. GiavonneRondo.com. So that's www.DRGIA, V as in victory, ONNERONDO.com. So
Awesome.
that's a longer version, but but I have both. So, I'm,
Perfect.
like I said, I'm still learning these things and just the whole website development and
Yes.
marketing. Whew, it's a lot.
Hey,
So,
if you can get through medical school, you can find a way through this too. Just have to be patient
yes.
and have compassion for yourself. But I want to thank you again for joining us on the podcast. It's very clear that you believe in this idea, but also this philosophy of being connected with the patient, whether it was seeing them in the hospital and seeing them outpatient, reconnecting back with the community, reconnecting back with yourself. I think there's a lot of parallels here of just reconnection and really getting to the basis of what true medicine is and being a healer and really being there for people and walking the journey with them and understanding the environment they're in and repurposing things when need be, as you had said about all the food you're trying to get out to people as well. So thank you again for sharing your story. And for those listening out there, I am Melissa Cady, the Challenge Doctor, joined by my co-host, Dr. Kevin Cuccaro. And we look forward to seeing you on the next episode of The Change Physician. And if you need to learn more about us, you can go to thechangephysician.com and join the community, whether you're a physician or a physician ally. Y'all take care.